You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, big topic, mommy makeovers. Women after pregnancy that are unhappy with their bodies are now doing something about it with a mommy makeover. From breast lifts to liposuction, tummy tuck, it's all right here. And my first guest is a board-certified plastic surgeon that has amazing transformation photos. So if you are unhappy with your body after children, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. My first guest is a board-certified plastic surgeon that is helping women throughout Fresno and California, for that matter, look better after pregnancy. Dr. Mark Chin. Dr. Chin, welcome to the program.
Well, thank you for having me.
Now, before we get into today's topic, tell me a little bit about your practices. You have two.
Yes. I've been in practice in Fresno for 15 years now.
All right.
And it has a combination of a Medi-Spa, but also a surgery center.
Two separate facilities?
It's under one house.
So they're attached, but one's a Medi-Spa,
Yes.
one's a surgery center. Okay.
We concentrate on surgical procedures and offer a wide variety of different surgery, but I also want to complement it with some non-surgical procedures. Sometimes patients aren't even ready for surgery, but yet they're looking for rejuvenation. They're looking for body shaping. They're just trying to improve the quality of their skin and their body. Okay. So that doesn't necessarily mean surgery. So I offer them non-surgical, less invasive procedures, but then also we have the option of going to with surgery to treat surgical problems.
Now you compared yourself to like a body shop. Elaborate on that.
Well, I often describe as the best.
You tell this to your patients.
Yes, I do. I'm like the body and fender guy, and I'm working on their dents and the dings. But they also need some detailing, and so I have the Medi-Spa, which includes a nurse, an aesthetic nurse, and a licensed esthetician who help me with working on the skin, trying to maintain what we were able to accomplish with surgery. So it's kind of a maintenance. It's also improving the quality of the skin, because surgery often doesn't treat the quality of the skin. It gets rid of some of the bad tissue. It puts things back into place. But now we want to improve the quality of the skin. We're trying to reverse some signs of aging, but
so
also...
you have lasers and intense pulse light machines. You do Botox, fillers. I mean, you do everything there?
Yes. I have an aesthetic nurse, and we both do Botox and fillers. We have ELOS, which offers intense pulse light, laser hair removal.
So that's, now the ELOS, by the way.
Yes.
That, it like heats the skin and produces more collagen? What is it?
It's a unique system that, it depends on what we're trying to treat. Oftentimes with the aging skin, we're treating hyperpigmentation, texture, tone, and also doing some tightening. And a lot of patients aren't ready for surgery, but this technology can combine different types of modalities such as radiofrequency, infrared energy, laser, intense pulse light to give a safe and effective method of rejuvenating the skin. We're improving the quality of the skin. We're able to do non-invasive procedures, but then let's say they want to have a more of aggressive approach. Then we have an Active FX, which uses CO2, fractional CO2 resurfacing in order to give a more of a quicker response. And
so like a fractionated laser, okay.
We have fractionated CO2 system now, which CO2 has been the gold standard over the years, but now that they've fractionated it, becomes safer, it's a faster recovery time, less redness and edema.
So are you kind of a technology nut? I mean, you have all the new stuff. Where do you stand on technology?
We do have high-tech systems in our practice. I find that I can't achieve all the results just by surgery alone. Okay. And so it helps complement the surgical results. For example, I think I do a decent facelift, and things are tightened, but they still have discoloration of the skin. We're trying to improve their complexion. In fact, I have a Visia complexion analysis machine. It does a computerized analysis of their skin, and we develop a treatment plan based on what we find. It shows UV damage, spots, age spots, hyperpigmentation, redness. And then
you use some of these technologies, by the way?
I've had photofacial.
Because I know your age, and you look at least, I'm looking at the monitor, about 12 to 15 years younger than you really are. Well, so good for you.
Well, thank you. I use the photofacials in order to help improve my skin color. my staff say I need Botox, but I haven't used that yet.
All right, all right. Now, did you always know you wanted to be a plastic surgeon, by the way? I always ask that to the doctors on the show.
I always was interested in anatomy, even in high school. I like the body and I like the body parts. And so as I developed an interest in medicine, I know I wanted to have more of an immediate effect. And that meant something like surgical, where we have the old saying, cut to cure. And so, in fact, one of the most fascinating things during my general surgery residency was working with a heart surgeon, Dr. Bailey, where we had a patient laying on the table. The heart was literally out of the body. We were waiting for the new heart to come in an igloo, and we transplanted that heart into the patient, warmed the body up. It started to quiver. We gave a little jolt to the heart, and we just
so you were hooked.
You just see life. And so I didn't go into heart surgery, but that was just the effect of having a surgical procedure. You can fix what was broken. And so then I developed an interest in the different specialties, and plastic surgery gave me the most options, working from head to toe, working from congenital, trauma, aesthetic surgery. So that gained my interest.
Okay, good. Now we're going to move into today's topic, mommy makeovers. What is a mommy makeover in your mind? How do you define it?
Well, I think we have to look at what the mother is going through. Typically, they're in their mid-20s to 30s, even 40s. You have to look at what happened to the body, to the mother, after they had 1, 2, 3 children.
Okay.
They may have had C-sections, so there's often have had surgical procedures. Their skin has changed. They develop hyperpigmentation, melasma. They have frown lines from scolding their children. You can often, you can often count how many children they have based on the frown lines. So they're getting Botox. They're getting photofacials. They're getting fillers to try to regain that youthfulness.
Because after the kids, I mean, you say, I mean, they still want to look pretty.
Oh,
still want to be attractive.
Oh, definitely. We have patients who are in their 20s and 30s. They've had their children. They're done having the family. Now it's mommy's time. They've raised them. They've gone to the soccer games. And now, really, they've tried to gain what they used to have. And
they still want to look pretty.
Yes, definitely. They want to look pretty. They want to look sexy. They want to look good in and out of their clothing. Okay. And they go to the gym. They work out. They diet. They exercise. But some things become surgical, and that's where we step in.
Has this mommy makeover become something where they come in and say, I want a mommy makeover? I mean, is that that word now being used out there?
It's a common term because that is referring to more of combination procedures. We get patients that come in just for breast augmentation, breast lift, tummy tucks, liposuction, but what we're seeing with mommy makeovers is that they still have children, they're raising them, and so they don't have a lot of downtime. So if we can do it safely at one time, then they're willing to take the time to do multiple procedures, and then they wake up and their breasts are lifted, they're fuller, they have a flat tummy, and that's what we're going after, and they're very happy.
You say you're changing people's lives. We are changing. Feel that way?
Yes, we're changing people's lives. We're also changing them back to where they were, and that's the biggest issue. I have some photos here. This is very typical. You see a patient, she's pregnant.
We've all seen that.
She's had 3 children, and you think, what happens to the skin? What happens to the body? Well, this patient has problems with.
That's a good-looking stomach, though.
Well, admittedly, it is, and a lot of patients would even just like to get to this point.
Yeah.
But for her. And I repeat that for her, it bothered her. She was unhappy looking in a bathing suit. She wears clothing. Her tummy still sticks out. She complained of extra skin. She's had 3 children, so there was wrinkling in her skin. Now look at the side view. She was trying to wear a dress, and it didn't hug her so well. She was embarrassed with it sticking out. She said, "Oh, it really stuck out." She was embarrassed. When she sat down, she had wrinkled skin. You're sitting by the pool. Patients don't like that look. Now, Randy, look at this front view. Here she is sitting down. You can see the wrinkles down here that are very apparent because
they're slight, but they're there.
But they just lost the elasticity. Plus, they have some bulkiness, and so she has a lot of this fullness. Her tummy sticks out, plus the loose skin. So then I have a question. Should I treat that with liposuction? Should I treat that with tummy tuck? And in the olden days, with just liposuction alone, I would have been hesitant because I don't want to make things worse. And so if I just do liposuction and they have laxity in their skin, they may have more looseness. Could be.
Okay.
So then I used Smart Lipo.
Yeah, what is Smart Lipo, by the way?
Well, Randy, I'm really excited about this new procedure. I use it in conjunction with traditional liposuction. It allows me to do a better job to treat the fat by using 2 lasers that melt the fat and also uses the lasers to heat the skin. I think I'm the only plastic surgeon in town that has...
In Fresno?
Yes.
Okay.
With smart lipo. And so I was able to use smart lipo in this patient in order to tighten the skin after I removed it with traditional liposuction. So it gave me better results, and it obviated the need for perhaps a tummy tuck.
So that before and after I'm looking at, that's a sitting down shot.
That's a sitting down shot.
Very nice.
And as you can tell, you can see more muscular definition. The wrinkles are gone.
Looks like an athlete.
Well, she is quite athletic, in fact. And she used to weigh 180 pounds. She lost 60 pounds trying to get back to this body. You saw her what her stretched out tummy looks like, and now picture her sitting at the side of the pool now. She's confident, she feels pretty, feels sexy, and she's able to wear this without any hesitation, whereas before she just wouldn't put on certain things.
So the side view is pretty dramatic. It just flattens it out.
It gives this shows the protrusion that she had before, and then that was due to the fat itself. And so now that the fat is removed, she's gotten a flatter appearing tummy.
Now in this other little lateral shot, I mean she looks, you got the hip bones showing now.
There's
almost,
more.
You
There's
could
more
almost see a
definition.
six-pack there.
Yeah. In fact, a lot of males would like this tummy.
Yeah.
Because it shows the raphe down the middle. It shows the outline of her six-pack. Her obliques are very well sculpted now.
It is subtle, but you can see the difference. Are more fit people coming in now for lipo and the smart lipo?
Well, we're seeing a trend in that. In fact, I've done 2 bodybuilders recently, one female, one male, where there's just a matter of trying to sculpt those areas that they're unable to achieve. There are some areas of resistant fat, and smart lipo is very nice to utilize because some of that tissue that we're trying to remove is very tough to remove with traditional liposuction itself.
Okay, okay.
Well, here's a fitness instructor. She came and she works out. She's at her pre-partum weight, and she has a issue with her breast. She has an issue with her abdomen. She does not like the way her belly button looks.
Okay, so that abdomen area, is that common, that skin like that?
It is very common. Most women have these signs of pregnancy. It's just that they don't show you. You don't see them in public. You don't see them
at the beach. Okay.
Exactly. They're covering this up, and that's why they come to our office. They want to have a better looking belly button. Even if they were able to wear something, show the midriff, they're unhappy. So in the side view, Randy, you can see that her breasts are deflated. She lost volume. They're sagging. She also has an abdomen that protrudes. It's due to the wall laxity, but also has this loose skin that is not tight. For a fitness instructor, you want to show off a body. You want to be the example of what you're trying to achieve with your clients.
All right.
Okay, and then here's from an oblique view. You can see the shadowing. You can
Doesn't look like a fitness instructor.
Well,
and that's
no,
just for babies. That's going to happen to a percentage of women that have babies. Is that right? Like 50, 60%?
Well, I think that a lot of patients can't control what their body's going to do after they lose the weight, after they shrink the skin, because a lot of that is genetics. And so a lot of it is from nursing and pregnancies. So what we're trying to do now is she's done all she can. She's done her job.
So what did you do for her?
We're able to give her fullness that she didn't have before. I know that the scars will fade with time, and so now with the breast lift, the nipples are in a better position. And look at that abdomen. Now it looks fit, it looks muscular, it's outlined. You can see the muscle definition, it's flat. Now she can wear low-rise pants, she can wear bikinis.
Do they act differently? I mean, did they get a change in self-esteem? I mean, do you notice it?
Oh, yeah. They notice it, their husbands notice it. It's just how they carry themselves now. And particularly for her, she's out there working their clients hard just to achieve, a similar physique.
We're going to take a quick break. When we come back, more photos. We have time for one more. Go ahead.
Okay, let me show you this one. This is a typical example. The patient is down to her body weight she's happy with, but now we have a deflation of her breasts. She wants more volume. She's sagging just a little bit, but she just needs that extra fullness.
What's wrong with diet and exercise, though, for a woman like this? Because she doesn't look far gone at all.
Randy, she already tried diet and exercise, and that's what got her down to this point. She's done all she could for herself. Now it becomes a surgical problem.
Okay.
And that's what we offer her with surgery. Diet and exercise aren't going to change the way her breasts look. In fact, they may make it worse, or she may need to lose so much weight that she looks unhealthy. So these are some areas that we treat, the resistant areas that we treat with surgery. Okay, on the side view, you can see how this sticks out past her breast. Her abdomen hangs. It has a lot of stretch marks. It's lost its tone.
Okay.
The abdominal wall is lax. It sticks out, and then you have fat and skin on top of the breast. And so even on the flanks, you can see that she has around her whole waistline, she also has a masculine...
Looks like a man from the back.
Exactly. It has a masculine appearance, and she doesn't have that nice V cut.
When you see this, by the way, I mean, do you say, oh boy, this would be a great mommy makeover? I mean, on the consult.
Yeah. What I see is, I see their potential.
Okay.
I look and say, I think I can improve here and here. And it's kind of exciting for me because if they say yes and they sign on the dotted line, we can have a nice result and a happy patient and a happy family. Okay, now let me show you about these afters. You know, we're talking about changing lives, Randy. And now we're changing her back to her body that she used to have before.
Yeah, I mean, she looked like an older woman before. Now she looks very young.
Fuller breasts are youthful looking. The abdomen is flat and tighter. In fact, you can see even where this belly button ring moved down to just above the pubic line.
Why is that?
Well, that's because the tissue in between the belly button and the pubic area is taken out, and then we stretch the skin, we tighten the abdomen like an internal corset.
Well, that's a fit abdomen, by the way.
Well, now it looks even more fit with the definition and the flatness that were achieved that she couldn't achieve by herself. Now on the after, the breasts stick past her abdomen. You see a flatter abdomen.
Huge difference.
And I think even the waistline is improved. She has a V cut now instead
very
of
feminine.
And it looks like she works out with her lats. Now I think this is the money shot, Randy.
Okay,
This is what patients love to see. This is what they actually get. And this is when they're sitting down, it is flat. And that can't be achieved with just exercise.
So now they're at the pool, they're sitting at the edge, and they're looking good.
They're wearing swimming suits that they didn't wear before. They're uncovered now. The swimsuit line is just there to hide the scars that eventually fade with time.
We're going to take a quick break. We come back, more photos.
I'm excited to show you some more.
All right. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're discussing mommy makeovers. If you are unhappy with your body, your breast, after pregnancy, you got to hear what Dr. Chin has to say. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light superactivates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We are here with the plastic surgeon that everyone in Fresno seems to be talking about and going to when they want to look better. Okay, we're talking about mommy makeovers. So it's popular. I mean, is this one of the most popular procedures now kind of going on out there?
Yeah, there's lots of mommies out there. There's lots of women who just want to get back what they used to have. In fact, I have a patient here who's a doctor's wife. So this is the front view, and if
she looks pretty good, by the way.
Well, yes, she is. But if you look at the side view, her tummy sticks out. She has muscle wall weakness, and you can't.
What does that mean?
Well, when you've had multiple children, she's had 3 children. The wall sticks out. It gets stretched out, then it relaxes, stretch out, and it's like a rubber band. Yeah.
And what do you do?
It just stretches out. I have to put an internal corset to flatten the abdomen so that when she's at rest, it stays in.
So I understand this correctly. Okay, so let's call it a 6-pack for a moment. Underneath there's a 6-pack, I guess, on everybody. So it spreads open. Is that what's causing the pooch, or?
the muscle and the fascia that holds muscles together stretch out, and it becomes weak and it sticks out.
So on this side view right here we're looking at, her muscles have kind of given out. Is that what you're saying?
They've stretched.
They've stretched.
She still does ab exercises, but it's not enough tone to get her flat. So she has too much tissue inside as well as outside, and that's where we put in stitches, permanent stitches, that flatten the abdomen. It gives them that sucked-in appearance.
Okay, so the afters, what are we looking at here?
You can see with the breast lift, she's much more comfortable now. And on the abdomen, she can wear different clothing. It can hug her. She doesn't have the abdomen that sticks out. Even on the front view, you can see how it's flatter, and there's less stretch marks, and there's the skin's tight. And again, when
another one of these money shots you referred to.
Yeah, when she's sitting down, you can see the looseness in her skin before, and now it's absolutely flat afterwards.
Okay, so you say you like to put your incisions low as possible.
Well,
elaborate on that.
Well, nowadays they have two reasons. They have the low-rise pants because they wear them extremely low, and so we try to keep the scars down where you can hide that. Also with the bathing suit or bikinis. If they wear a thong, I can't help them.
Now we have time for just a few more photos.
Randy, this patient comes to me. She's complaining about large breasts. They're hanging. They're down to her abdomen.
And they're uneven. You could even those out?
Yes, and the abdomen is in the way. She has stretch marks, the skin's hanging, she's had C-sections. It folds over the abdomen. And look when she's sitting, she has a large apron, and that is just in the way. You know,
and you say that, I mean, that's a young woman. She's 45. Looks much older when she's sitting.
That's the thing. They make them feel older. And once you do the surgery, they feel more energetic.
So what did you do for her?
Okay, now Randy, look at the huge difference that we were able to accomplish. The breasts are lifted, they're more even, they're fuller. The abdomen is now flat. It looks like she has been working out now. The scars are low.
Yeah, she looks good.
Even in the sitting position, I think it's very dramatic.
Oh, yeah.
That's that money shot again, where she is able to sit at the pool. She can show off her tummy. It is not in the way anymore. She feels more comfortable wearing clothing.
That was a doctor's wife.
Yes.
Do a lot of doctors send you their wives, friends, things like that? Do you get referrals from the doctors?
I have several doctors who refer me, their patients, their families. I think it just kind of gives me a vote of confidence on their part.
Now, now you say the big fear. There's a lot of people, and we are out of time, but there's a lot of women out there that are really afraid of the incisions or the scars. Well, and it keeps them from doing something, and that's a legitimate fear.
Sure it is, and we discussed that during the consultation.
What's your take on that?
Well, Randy, we go over this during the consultation. I have to ask them, what would you rather have? Would you rather have this body without scars or this shape with scars? And
that's a good point.
Invariably, they want to have the surgery.
So incisions or scars, should that be something that keep people from doing it?
I don't think it should limit.
Is that the number one fear, by the way?
Yes.
It is?
Yes.
Okay.
But we have ways to modify the scars to reduce them with time. We have ways to do scar reduction even with some of our light-based systems that we have in the office.
Okay, time for one more.
Okay, let me show you this quickly. This patient here, she's struggled with her weight. She's still a large frame woman, but she complains that her breasts are sagging, she doesn't have the fullness, and she has an abdomen that
a couple of kids, 3 kids in her place?
About 3.
How old is that woman?
She's about 45.
Okay.
And she has an abdomen that is just draping like an apron.
It is like a spare tire.
Yes, and so what we did with her is we were able to do a breast lift to give her more fullness. We used an augmentation for the roundness. She got some more cleavage. They're off her abdomen.
So even in the after, that's a plus-size woman, you say?
Yes, but they
looks very fit.
Well, it gives her a better shape. We've added the curves where she needs them, and we're able to give her a flatter tummy, less overhang. She's more comfortable with herself. She's more comfortable with her private life as well.
Do they ever tell people? I mean, some people aren't shy about it. They say, "Hey, I had a mommy makeover."
We have patients that can take credit, and I give them all the credit. They've gotten down to their weight, and I think the biggest compliment that they have is when people come up to her and they go, "You've had how many kids?" And it's
really?
Yes, and they can take credit for it, and I'm just happy to help them get there.
Now, on the consult, and we really are out of time, but do they bring their significant other? Do they bring family members? And do you encourage that?
Yes, I think it's very important for the spouse to come because they may be happy with what they see, but it helps them understand their complaints. They're telling me, I'm sympathizing with them. I can explain to the husband what we can achieve, and I think if you have a happier wife, you have a happier family as well.
All right, okay. Now we are out of time, but we didn't get a chance to talk about safety and where you do your surgeries, and I know you're big on that. This is a big topic.
It's a serious note. I have privileges at all hospitals, but one of the things we have is accredited operating room. I have
So there, on site.
on site in the facility. I pick and choose my patients too. They have to have a clearance. They have to have pre-testing, and if they're a candidate for combination surgery, we'll proceed. And we do a lot of preventative measures so that they have least amount of complications.
What about those critics that say the problem with doing a combination of procedures, breast, tummy tuck, maybe lipo, it's dangerous?
I don't believe it's very dangerous. I think there are some risks involved, and we have to pick and choose our...
So picking the patients.
Yes, and we have to have preoperative screening, we have testing, and if I think that they're going to be safer splitting up the surgeries, then we'll do that.
You do that, okay.
We'll do one stage first, second stage. But if they're a good candidate, there's a lot of pros and cons. And the pros are that they get to take the same time off. They're on the same medication, same recovery time. Because remember, these are mommies. They have downtime, they have children. And so if we can get them down at 2 weeks versus 2 weeks here, 2 weeks there, they're much happier. And the husband, because he's the nurse, is a lot happier to do it one time.
Now, if somebody's watching this and they want to know downtime, on some of these, you know, they had a tummy tuck and breast lift, when could they go back to work?
Usually it takes about 2 weeks for the swelling to go down, for the soreness, and they're off medications. They're usually off medications for about a week, and then they can drive about that time.
Do they ever go back to work early, behind your back, or against your wishes?
Sometimes they
like
do.
A week later?
Sometimes they do, and I have to tell them to slow down because I don't want them to develop any...
because of the healing process, is that what you're...
It does take time, yes. It does take time and to feel good.
Okay, you like what you do? I mean, you love this?
I love this, and it's so gratifying to be able to help these patients who have helped themselves, and they present with a problem that we can fix, we can solve, and so it's just they're happy. My whole staff is involved in this team approach. It begins with the receptionist to the recovery room nurse, and if we can give them the confidence that we are going to take care of them during this whole process, not just surgery, but the recovery time, they are so gratifying, and they keep on coming back. They refer their friends, and so that's the accolades that I get from them. And
all right. So somebody watching this, they're not happy. They've had a few kids, not happy with their body. Where does it begin? What's the first step?
Begins with a phone call and making it a consultation. The consultation, there's no obligation.
You meet with them?
Yes.
One-on-one, okay.
It's gathering information. I'm there. I don't presume that they want to sign up for surgery, but I'm there to give them their options. They tell me what they don't like, and I try to determine what they expect from surgery. And if I can achieve that goal, then we become a team.
All right. Well, I want to thank you for coming on the show. Very good. Very interesting. Great photos, by the way.
Thank you.
Some of the best I've seen.
Oh, thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.